Ru'a Rimawi. I'm a Postdoctoral Fellow at Dana-Farber Cancer Institute. So I believe breast cancer is one of the cancers that we have achieved a huge progress when it comes to diagnosing and treating it. And we've definitely come a long way, which is so heartwarming and brings us so much hope. But at the same time, we still have a long way to go. I work at the Science Health Education Center at Dana-Farber, and our focus is on the Middle East and North Africa, the MENA region. And we look into inequities to accessing diagnosis and treatment and how they contribute to disparities in survival among cancer patients, and specifically breast cancer patients. So it's really heartwarming to see how far we've come when it comes to treating cancer in some of the countries and communities, but at the same time, it's very heartbreaking to see how long we still have to go when it comes to breast cancer in underserved communities and underprivileged communities who suffer from huge limitations when it comes to accessing diagnosis and treatment, which definitely has a direct impact on their survival. So we try to address these inequities and come up with work on collaborative research projects to come up with evidence-based interventions and implementations to improve the situation for these cancer patients. Yeah, definitely. I think there are a lot of unique characteristics when it comes to breast cancer in MENA. First of all, breast cancer is considered the most common and the leading cause of cancer-related deaths among women in MENA. The survival rates can be as low as 40% in some of these countries, in comparison to 90% in countries like the US, which shows the huge disparities that we have. Most of the patients get diagnosed at advanced stages, which, as I said, leaves very small room for treatment and interventions. Access to palliative care is non-existent in some of these countries. MENA is known to be affected by political instability, conflict, and war, which leads to displacement and has a direct impact on the delivery of healthcare among these communities. So it's a very challenging environment to work in, and at the same time, it is also very important to understand the cultural aspect of the disease. If you look at the studies studying the causes behind the low percentage of participation in early detection programs among women in MENA, the most common addressed factor is the stigma, the social stigma. There is a big social stigma. There is fear, there's a lot of misinformation, there's lack of knowledge, and this lack of knowledge is documented not just among patients, but also among healthcare professionals when it comes to breast cancer screening guidelines, when it comes to most updated criteria and diagnosis and treatment. And this lack of awareness, this lack of knowledge has huge consequences on the delivery of cancer care in the MENA region. So what we try to do is to build the bridges and create collaborations between scientists, healthcare professionals at Dana-Farber, Harvard community here in the US, with researchers, healthcare professionals in the MENA region. So we create an exchange of knowledge and expertise, and we provide them with the clinical skills that they require and they need to advance the delivery of cancer care in the region. And we believe that by investing in capacity building, this change can be sustainable, because we are training the leaders who will be training the next generation in the region. So yeah, that's the vision and the whole mission of the She Center and what we do. Definitely. It's all about, that's why, first of all, I believe in the importance of what we do, the importance of building this community, because we're bringing the experts in the field from all over the globe to exchange their expertise and exchange the knowledge. So by creating these bridges, by creating this exchange of knowledge and expertise, we can fill in the gaps that are missing in MENA region. So I believe that the interventions have to be guided by the local communities. It shouldn't come from what we think needs to be done. It should come from the people on the ground who are practicing, and they should be the ones who guide us in how we can help, how we can advance the situation. So that's what we do. We first start by creating collaborations with the big cancer centers, the big hospitals in the MENA region. We start having in-person meetings with the policymakers, with the healthcare professionals, with the oncologists, the researchers, and we also have conversations with the patients too, to understand also the patient perspective. And then after these conversations, we come up with plans on how we can advance and improve the situation. So one of the things that we personally done, and I think it would be very nice if we can join efforts and work on advancing the delivery of this mission, is first of all by conducting workshops. We bring experts from the US to the MENA region to give workshops in the advancement in diagnostic tools, the advancement in treatment, the new discoveries, the updated criteria, and to also have conversations whether these things apply to the MENA or not, because most of the criteria has been developed in Western communities and we're not even 100% sure if they apply to the MENA population. So by connecting them together, I believe they can come to this understanding of how these criteria can be adapted to the region. That's one way. The other way is to focus on advocacy and patients' education. So we also arrange a lot of walks, a lot of workshops, a lot of just events to create safe spaces for patients to come in and share their experiences, which I believe is also very important, because when these patients start talking about the challenges that they face, the limitations that they've noticed, it can direct our efforts and our interventions. Another way is to bring researchers, healthcare professionals from the MENA to get training in a country that has the facilities, in a country that has the infrastructure to train them in the specific field that they're passionate about and interested in, and then they can take this knowledge back to the region and train the next generation. So this way, this is a sustainable impact. And if we can join efforts and advance this, I believe that is going to be very important and critical.